My name is Tata Chanturidze. I'm a principal consultant in health systems, governance and financing. I work with Oxford Policy Management, United Kingdom. I was asked to work on a case study on Georgia to help unpacking how, when and why this particular country learned from the evidence accumulated globally to incorporate it into the health sector reforms at the different stage of the reform implementation, which includes conceptualization, internalization, implementation, monitoring and evaluation. What it was about in practical terms is that we went to Georgia to interview different stakeholders, and this included the members of the parliament, vice ministers, representatives of international agencies, civil society, trying to understand how Georgia used the global knowledge accumulated up to now during the last 2 decades of health sector reforms to see whether it was consistent during this period, it was differently applied for the health financing reforms rather than health service organization reforms, and how this thinking obtained from different stakeholders came all together. The country was selected for a case study primarily because of 3 reasons. Firstly, because after the collapse of Soviet Union, Georgia made noticeable progress in terms of economic development. It moved from low income country to low middle income country. So the second was that Georgia made significant progress in terms of millennium development objectives. And thirdly, because Georgia undertook significant health sector reforms. Some of these were driven from with the support of international organizations and very much based on international evidence and knowledge, but some others were homemade reforms. And sometimes these reforms were quite different from the exercises undertaken in the region, and sometimes quite radical as well. It is clear that evidence was differently applied during different stages of health sector reforms. For example, if we look and think about health financing reforms, these reforms were happening with the support of international organizations. And at the stage of conceptualization, when the country was forming its understanding of what kind of reforms they wanted to pursue with, I think it was a lot of influence from international organizations supporting to solicit the evidence and to learn from the experience of other countries. On the other hand, when Georgia was considering the hospital privatization reforms, again, the evidence was collected, but it wasn't taken into account at the same degree. So the conclusion from this analysis is that, yes, everybody recognizes that it is important to collect the information about the global knowledge, but then it gets differently applied. So this application is very much dependent on the political agenda, and it is kind of predefined which segments of the obtained information and knowledge will be used in policy decisions. I think the most challenging part, and if I would say a bit sensitive, was the fact that I was interviewing my former colleagues, because I'm originally from Georgia and I was a vice minister a decade ago in my country. And when I was interviewing these people, basically I was hearing their comments and their judgment about the reforms which I was designing and oversighting. And main challenge for me was to remain objective, because I didn't want to mix up emotions from memories and considerations about the work I've done with the absolutely objective judgment of the reviewer and the researcher at this case. If I'm asked to summarize briefly the current state of the Georgian healthcare system, I would start from the positive, and I would say that Georgia is progressing very well towards the universal health coverage. The current government increased the state funding for health sector, and I think it's visible. People appreciate that there is a lot of support coming from the state. But I think that main challenge is related to the organization of hospital services. Because of the radical privatization reforms which took place a decade ago, a lot of power was transferred to the private players without preparing the environment to oversight and regulate the sector. So the weakness of the reform was the speed of the privatization, but also lack of preparedness in terms of regulations to oversight the quality and the cost of the hospital service delivery. And I think Georgia is currently facing the implications of these reforms. If I'm asked to choose 3 words to describe this project, that would be informative, consolidation, and potential. Informative, I think it's self-explanatory, but I would say that we collected much more information than we expected to do. Consolidation, because we knew that there was a wealth of knowledge and insights among stakeholders we were going to interview, but I think that this research helped us to put all this great thinking together to be very clear about the application of evidence in health sector reforms in Georgia. And potential, this is linked with my hope. I do hope that the information which was collected from the case study of Georgia, but not only from Georgia, but also case studies done in other countries, will help aid partners, the governments, and private foundations to think more how they can support evidence-based policy making in health sector. This project was particularly interesting and exciting for me because first I observed that national stakeholders in the country I've assessed were absolutely well informed about the importance of evidence-based decision making, and they were interested in creating more sustainable platforms, national organizations, national setup to support this process. It also underlines that there is a big role for the decision makers in supporting the application of evidence. Yes, there could be the process which allows to solicit the evidence, to understand it, but then whether this is applied or not, it really depends on the policymakers and decision makers in power. So we learned to, we saw the need to work with policymakers in order to support these processes. And the second aspect of it was also to see that there are a lot of big and very powerful, influential players globally who are interested to support developing countries in applying evidence in health sector reforms to avoid mistakes, to save resources and accelerate impact for the sake of the better health of population. And this was truly encouraging.